Hello, I'm Professor Kathleen and I'm going to talk to you about MQ Health and our postgraduate professional courses. What I'd like to do is give you an overview of our faculty and the areas of study. A look at MQ Health, which is our Academic Health Sciences Centre, its values, as well as the values of its learn or educational endeavour, and then why you should choose Macquarie to come and study health courses. The Faculty of Medicine, Health and Human Sciences expanded this year and has a number of larger areas of study. In the undergraduate space, we look at human sciences, linguistics, medicine and health sciences, psychology and cognitive sciences, speech and hearing. And in the postgraduate space, we look at clinical audiology, linguistics, medicine, physiotherapy, psychology, public health, speech pathology. We also offer high degree research. You can do a Masters of Philosophy, a PhD, a Masters of Research, Masters of Public Health Research. We also offer a series of continuing professional development, for example, in the area of lymphedema. Conceptually, we think about our courses into broad categories, a broad academy, a pre-professional academy, and then a professional academy, which is really in the postgraduate space. The Broad Academy provides a wide area of our areas of study, opportunities to study broadly. The Pre-Professional Academy has that broad depth too, but it ensures that you meet the prerequisites for some of the Professional Academy. And the Professional Academy gets you ready to enter a profession. They're usually accredited courses. So there's lots of connection between the different types of courses or different categories of courses. And all can lead to a profession or a career. And there's opportunities to move between both, or all three of them. But what I wanted to focus on today was really the postgraduate clinical courses. And they kind of fit in two areas. In the Broad Academy is really the Masters of Public Health. A lot of health professionals take a Masters of Public Health when they've been working in the industry for some time and they want to study it more. Or it could be some undergraduate students who have really developed a passion for public health and want to actually undertake a master's straight away in order to direct their career in that direction. The health professional courses we offer let the graduate enter the profession. So you can complete a Doctor of Medicine to become an intern and enter the New South Wales health system, Doctor of Physiotherapy to be a graduate physiotherapist, an audiologist. You could become a clinical psychologist, clinical neuropsychologist. You could do a Masters of Professional Psychology with a broader psychology qualification, or become a speech and language pathologist. There are another professional course which actually touches on health, but often has wider application to other industries, which is the Masters of Organisational Psychology. We have an Academic Health Sciences Centre, and this video encapsulates what it's about. We have our own hospital and clinics on campus that are university owned and operated.
We are eyes. We never stop searching. We are hands, warm like blankets and still with certainty. We are ears, loud or soft, we always hear. We are feet, carrying us on your journey. We are arms, always ready to fight. We are the fuel that supports body and mind. We are the brain. We'll never give up trying to understand. We are the heart. We beat with one purpose. In an Australian first, MQ Health integrates world-class clinical care, teaching and research with one goal in mind: to deliver the best for our patients and our community.
As you see from that video, MQ Health is encapsulated, its core purpose is encapsulated in 3 words: heal, learn, discover. So we want to put our patients first to deliver clinical care, learning and research that's progressed through evidence to become a world-class university health scientist centre which will truly integrate clinical care, learning and research to improve lives. We're a values-based organisation, and there are 6 core values that underpin our endeavour in the MQ Health space. These are caring, integrity, teamwork, ambition, innovation and engagement. If we think about the learn part of heal, learn, discover, or the learn endeavour, its core purpose is also encapsulated in 3 words: learn, grow, thrive. Here, our mission is to put students first, to inspire and engage our students to become outstanding communication, health and research professionals, advancing health and wellbeing of the individuals, industries and communities we serve. Like MQ Health, we are a values-based organisation in the learn endeavour, and our values very much align, but they're just slightly different to focus on the students. We share the same values, 4 of the same values: integrity, teamwork, ambition and innovation, but we also have empowerment and sustainability as important values that underpin our learn endeavour. You should come to Macquarie for 7 clear reasons. We have exceptional learning, we have an exceptional ecosystem, exceptional learning ecosystem with MQ Health, with fantastic facilities, outstanding staff, small cohorts, very well designed courses, interprofessional learning and synergy across our courses, and clear pathways to rewarding careers in health. MQ Health is an exceptional learning ecosystem with our own hospital and clinics on campus to deliver, heal, learn, discover. But also, we have outstanding partnerships that enable our students to learn about both the public and private healthcare sectors, which is exactly the sectors or exactly the organisation of the Australian healthcare system. We have partnerships with New South Wales Health, which provide opportunities for our students to do placements in New South Wales public facilities. We have partnerships with international organisations and hospitals, such as the Apollo Hospital Group in India, and our medical students have the opportunity to spend a substantial time in 3rd year at the Apollo Hospital Group in Hyderabad, India. We have clinics within our Australian Hearing Hub, and we have Cochlear, a world-leading hearing company, housed on our grounds, providing opportunities for students and placements. We also lead in digital health with MindSpot, a clinical service that delivers mental health services over the internet, which is housed here. These are some of our partnerships, but what we have ensured is we have extensive partnerships with a number of providers, which ensures our students have an exceptional learning ecosystem. You should also choose Macquarie because it has the state-of-the-art facilities. Macquarie's venture into health is reasonably recent in the last 15 years or so, which means our facilities are state-of-the-art, purpose-built, designed with students in mind. In the bottom right corner here, you can see our brand new clinical education building, the Ainsworth building, which has recently opened, which provides fantastic facilities for our health students to learn. There are also state-of-the-art facilities across the campus, also in the Australian Hearing Hub, where our speech and hearing clinic is housed and our psychology clinic's housed. And we share facilities to look at engagement and culture and connection across the campus. You should also come to Macquarie because of our outstanding staff. Starting at the top, on the top row here, our Vice-Chancellor, Professor Bruce Doughton, teaches health leadership in our health professional courses. Next, Professor Patrick McDeal, the Deputy Vice-Chancellor of Medicine and Health, teaches into our program in medicine and physiotherapy in his areas of expertise. Professor Kath McMahon is a leading hearing researcher and audiologist who teaches into our audiology program, but she works internationally with the World Health Organization, trying to improve hearing health across the globe. Associate Professor Joel is an outstanding educator and researcher in the area of psychology. She is the course director of the professional psychology program, but she oversees all the professional psychology courses. She's also a leading expert in retirement savings and provides advice to the New South Wales Government in the Ministerial Council for Ageing. On the bottom row, Professor Geoffrey Braithwaite is the Director of the Australian Institute of Health Innovation, and his team leads, which is housed in the faculty, leads research in implementation science, health systems, and safety and quality in healthcare. Associate Professor Taryn Jones is a leading educator and course director of the Doctor of Physiotherapy program. She's innovated the curriculum and is really focused on how to help the students gain the capabilities to be future-focused health professionals. Professor Dominic Rowe is a leading expert clinician researcher in motor neuron disease. He leads the largest motor neuron disease multidisciplinary team and works closely with our researchers to deliver the best care for people suffering motor neuron disease. And Professor Janaki Edmin is the course director of our Masters of Public Health, and she's an epidemiologist and leading researcher who's been involved. Her services have included working with New South Wales Health to manage the COVID-19 outbreak in this state. You should also choose Macquarie because we have small cohorts in our health programs, which ensures that students are known and that your education is tailored. Our programs are very well designed. They're outcome-based to meet all the professional requirements, but they include innovative and extended curricula in order to ensure that our students are future-focused or have the capabilities that they need. Here is a clear example of some outstanding work that our students have completed. These are physiotherapy students who are asked to design an advocacy campaign. Just watch this short video and you'll be amazed by their outstanding work.
Where am I? Why does everything hurt?
我哋攞佢血壓，
Who are these people?
然後俾啲藥佢。
What's going on?
血壓係喺呢度。
話俾我知發生咩事。
Wait.
我睇你血壓，
What are you doing? I don't understand. What's happening?
放喺手度。
It hurts. No, please stop.
Amy 你唔好喐啊，
Please-
你冷
please
靜啲下，冷靜啲。唔使緊張，冷靜啲 ，Amy 冷靜
What's going
啲，
on? No,
你冷靜
no.
啲，
冷靜啲。
Can no one speak
冷靜
English?
啲，
No, I don't understand what you're talking about. What are you saying? No.
冷靜啲，冷靜啲。
你冷靜啲。
No, I don't understand.
I'm sure you'd agree that was a very powerful video and showcases the skills that those students who are now graduates have developed. Part of the innovation in our curriculum is also providing the opportunity to conduct research that actually changes practice, pitch business ideas, develop LinkedIn profiles, but also develop communication strategies that are needed for the modern health professional. So how do you communicate with the public about various health conditions? So our students get to practice writing blog posts and things like that. With the number of health professional courses, we have also worked to ensure that there are interprofessional opportunities because healthcare is not an individual pursuit. It really requires teamwork across a range of professionals. And we try to connect our students so that they can connect, communicate and collaborate. They share a series of online modules which they work through, but importantly, we strive to build a community between all our health students. The other reason to come to Macquarie is that there are clear pathways, whether you're someone thinking about a health career, there are clear pathways from our undergraduate study into our postgraduate health programs. And those pathways are You can start anywhere and you can connect between them all. So there is clear connection between them. You know, if you start in a pre-professional academy, you will actually meet the requirements for the professional academy. But you might also decide that there's other things that after you've completed that course, other things that you may want to do and you might want to build your career. For example, if you think about the Bachelor of Clinical Sciences, there's lots of options. You could take the clear horizontal path to medicine. You could think about becoming a physiotherapist, or you might want to undertake Masters of Public Health. You might want to take a public health research or Masters of Research. Even if you take the route to medicine, you could join the profession and do our Doctors in Training program. So there's lots of opportunities. There's also rewarding careers in health here at MQ Health. If you think about medicine, there's the Bachelor of Clinical Sciences, that can lead to the Macquarie MD, which can lead to becoming an intern in our health system, and then becoming a specialist if you'd like, because we have some advanced training opportunities as well. You can come back and be involved in teaching future medical students. But within our clinics, our graduates can be employed within our own clinics. In the photos here, we have our graduates in physiotherapy and audiology working in our MQ Health clinics. So there's lots of opportunities, and we'd welcome you to join us here at MQ Health and Macquarie University to advance your career in health. If you want further information about MQ Health or the university, here are the web addresses. Thank you.